Hello, I'm K.Waitt, and this is my book club presentation on the book Mountains Beyond Mountains by author Tracy Kidder, published in 2003. The vulnerable population group in my book was that being served by Dr. Paul Farmer, the impoverished Haitians primarily living in Conge in the Central Plateau of Haiti. The Haitians in this area suffered from extreme poverty, an epidemic of tuberculosis, which would become multi-drug resistant through the years, HIV, AIDS, lack of infrastructure, and political unrest. Health disparities were many: access to basic health care, structural barriers, infectious disease, and global inequity, with the primary health disparity that Dr. Farmer recognized was simply that the poor were given barely adequate low-cost health care, but the wealthy, such as those in America, were given the best medical resources. The idea that some lives matter less is the root of all that is wrong with the world, Dr. Farmer was quoted as saying. I learned that I can meet my patients where they are and focus on their humanity. Even in the ICU, I can listen and talk and provide emotional support, something I'm good at, but I can always improve upon. And I learned throughout this book that circumstances and culture matter. If my patients aren't being compliant or they've returned to our hospital multiple times, it may not be because they don't want to be compliant. It could have to do with their circumstances. It could have to do with their culture. And we need to take the time as nurses and clinicians to investigate this and see how we can help and educate ourselves on why these things are happening. I also learned that in end of life, dignity, comfort, and compassion are key. I knew this, but there's a story in the book that highlighted it and is one that I'll think about for a long time. I also learned that systemic change is possible and one person can make a difference. We may not make a difference on the level Dr. Farmer did, but we can make a difference in our hospitals, in our facilities, in our communities, and that might extrapolate into the world. I also learned that passion and intensity are great, but Dr. Farmer is a reminder that we need to take care of ourselves too. Health promotion that I can provide to my patients include prevention of infectious disease through screenings, vaccines, follow-up care with providers, addressing environmental issues like running water in their homes. Do they have heat during the winter or AC in the summer here in Texas where it gets very hot? Nutrition deficits and how I can help my patients to improve their nutrition little by little. It's expensive to eat healthy, but as a nurse, I have an opportunity to work with dietitians to provide them with tips that can help in that area. I can also work with our social worker to make sure my patients have the ability to pay for medications, get community resources if they're struggling with that, and advocate for the patient by talking to providers when they prescribe a medication that is extremely costly to see if there is an alternative that my patient might be better able to afford and be compliant with because they can actually afford their medications. Health literacy is something we should always promote, and I can work with my patients to provide them information in a language they can understand and at a level in which they can understand it. For new nurses, I think Mountains Beyond Mountains could be an excellent learning tool as it opens up our eyes to ethical awareness, specifically justice. Dr. Farmer and his cohort recognized injustice and they found a way to change it, first with a community, a country, and then with the world. Compassion, I don't think is something that can be taught, but it can be inspired, and Dr. Farmer and PIH's work does just this. They proved that medical care and compassion go hand in hand, and the people of Haiti, Peru, Russia, and beyond needed this type of care. Everyone deserves it. And I also think that new nurses can have an interest in public health sparked by reading this book. It has the potential to encourage more nurses to get involved in public health here and abroad, and I think it's an excellent reference. For veteran nurses, it's a little more difficult to speak on because I've only been a nurse for about 7 months, so I don't pretend to know exactly what veteran nurses go through, but I do think this book can challenge thinking and serve as a reminder that every life has equal value and help veteran nurses to look at their practice and see if any biases or compassion fatigue have affected their work. Have they become complacent, become from exhaustion? Do they give the same energy and advocacy to all of their patients? Do they need to make any changes? Veteran nurses are also ideal for advocacy and leadership. Reading Dr. Farmer's work and that of public health or Partners in Health as a whole has the potential to empower veteran nurses to influence policy and make changes not only at their local and hospital level, but statewide and nationwide. All they have to do is advocate, and then they can in turn inspire us as new nurses. Dr. Farmer served and made lasting impacts throughout his life. The stories are woven throughout this book and others about him regarding this impact. I think veteran nurses need to take some time for self-reflection and look back at their careers and remember that they have made lasting impacts on many. Surprises that I noticed in the book. The simple vastness of the inequity that the Haitian people and those in Lima, Peru, and the Russian prisons had in the 80s and 90s and early 2000s. It was eye-opening, to say the least. I also was surprised that one man and his close team made such a difference, and that difference is still being seen today and has made major changes in public health throughout the world. I Googled Partners in Health, Zambé La Santé, which is Partners in Health in Creole, it's the facility in Haiti. And I also Googled Dr. Paul Farmer to learn a little bit more about him. And I explored how to get involved with the work of Partners in Health. What stayed with me the most was the story of John, an 11 to 12-year-old boy who was diagnosed with a rare but treatable nasopharyngeal carcinoma. He didn't live. If he had access to care sooner, he would probably have lived. If he'd made it to Boston sooner, he would have lived. If he'd resided in America, he would have lived. If he simply had good roads, he would have lived. But he died in Boston at Mass General in a clean room without flies on his face and his mother by his side. Partners in Health and Dr. Farmer paid $20,000 to get this young man to America so he could be granted a chance. And although treatment didn't work, he was given dignity in death. And that is something that should be granted to all human beings, but it is something that is not. Did the book affect my mood? Yes, it was heavy, inspiring, thought-provoking, and overwhelming at times. I cried, but it was an excellent read. Lingering questions. Following Dr. Farmer's death in 2022, I wonder if the legacy and the work of Partners in Health will continue long-term, and I hope that it will. And it made me wonder how I can make a difference at a local level. My review of the book is that health is a human right. Tracy Kidder's Mountains Beyond Mountains is an inspirational tribute to the lifelong work of Dr. Paul Farmer. Kidder beautifully and intimately walks the reader alongside of Dr. Farmer in Haiti, Peru, Russia, and Boston. The book shows us that one person can make lasting impacts and inspire a generation. Déamont Gemont is a famous Haitian Creole proverb that translates, "Beyond mountains, there are mountains." It was one of Dr. Farmer's favorite proverbs. It signifies that life is a series of continuous challenges where overcoming one obstacle often reveals another, highlighting resilience, persistence, and the ongoing nature of the struggle. As nurses in healthcare, I think we can learn from this. Below are my references. Thank you.